There's a fear of getting help, let's say, fear of getting help in general. Some people have bad therapists, have had a bad experience. Some people have gone to couples therapy and felt like, I don't know, they didn't feel heard. They felt like their spouse and the therapist ganging up on them. They may have had, if they haven't had therapy before, they might not even think that's what helps, right? They're like, why should I talk to someone? Why should I talk to a stranger about my problems? Like, that's not going to do anything, right? It's really, I need to get pregnant or whatever. So they might not trust that therapy is actually going to help. They might not have hope. This is not even to mention that, other levels of help, right? That I'm just talking about right now, just like help, like a psychotherapist, but I also mean psychiatry or going to the ER, right? Going into inpatient, something that really stabilizes someone. So if someone is like really, really severe in an episode, like they're manic or they're going to hurt themselves or they are in a really bad place, they might be afraid of being taken to the ER because sometimes hospitals are scary, right? I feel so sad that that is like our only option. I mean, now having some experience working in the ER, I kind of get, the whole workings of it, so it's less scary to me. But it could be terrifying. You're at your worst state, and you're sometimes picked up by the police, which could have lots of systemic, racial, social implications, right? You're treated like a criminal when you're feeling just like really sad or really out of control. And then you're taken to this room where you're kind of locked up and and your stuff is all taken away. It could be pretty traumatic to get help, right? I mean, all of that is in service of keeping someone safe, right? Like they take away all your stuff in your pockets and your phone and stuff like that because they don't want you to hurt yourself in the hospital, but that could feel terrible. So it doesn't feel like help, right? So it makes sense that a lot of people don't trust getting help. Even inpatient hospitals, if people have had experience in that, it's not pleasant, right? You're around people you don't know, you feel controlled, you feel like you don't have a say over your schedule. It's just sometimes the hospitals themselves are just like scary. So if anyone has that experience or even misconception that all hospitals are terrifying and doctors are just there to like drug you up and leave you there, then you're not going to trust getting help, right? So there's not only the shame or the feeling of like something's wrong with me, but there's also like, what does help look like? And it will actually be helpful, or is it just going to make things worse?